Hello, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's my pleasure today to introduce Dr. McGee. Dr. McGee is an expert in plastic and reconstructive surgery, and we'd like to share a little bit about her background, her training.
Well, thank you, Greg, for having me. I'm really excited to be here. I'm from Reconstructive, Louisiana, which is by Lafayette. I did my undergraduate training at LSU, and then I did medical school at LSU in New Orleans. I did a 5-year general surgery residency at LSU in New Orleans, and then a 3-year plastic surgery fellowship at Wayne State University in Michigan. And then I just completed a 1-year microsurgical fellowship in University of Kansas in Kansas City.
So you can see Dr. McGee has plenty of training, and it's such a pleasure to have her here as part of the plastic surgery, reconstructive surgery program at Thibodaux Regional. And there's many capabilities that training has enabled you to provide to the people of this area. You want to talk kind of broadly about the type of things you do?
Yes. So I focus on cosmetic surgery as well as reconstructive surgery, especially after cancer, trauma, or congenital illness, as well as non-surgical rejuvenation.
If we do a lot of breast cancer surgery and treatment at Thibodaux Regional, chemo, radiation, surgery, and for those patients that choose to have reconstructive surgery, we won't get into all those details, but you would be very comfortable helping them and going the direction they think they need to go, making recommendations and actually performing the surgery.
Yes, so I perform both implant-based reconstruction as well as free tissue transfer for reconstruction.
And some of that could just be cosmetic surgery. It's not related to cancer care.
Yes, I do also cosmetic surgery, including breast augmentation, as well as abdominoplasty, and facial rejuvenation.
So I was wondering if I could get these wrinkles removed before.
Of course.
Well, that's another subject. Yeah, so if someone has let's say it's a scar, I'm going to kind of make this up, I'm not clinical, and they want to do something about it. They want to try to improve the appearance. You're a person that's trained to address those kind of issues, right?
Yes, so I'm trained in different aspects of wound care, including scars, burn scars specifically, and so there are different modalities that we can use to help treat those scars, some non-surgical and also some surgical.
So that extra training you had beyond your 5 years of general surgery, 3 years of fellowship in plastics, and then another year in microvascular surgery. Why don't you take a moment, Dr. McGee, and explain what is microvascular surgery? What is it?
Yeah, good question. So that's where we take tissue and hook it up to blood supply on another part of the body, usually for reconstruction. And so that helps patients achieve wound healing quicker, as well as just reconstruction, like after breast reconstruction. We're able to create breast out of abdominal or thigh tissue.
Wow. And you collect the tissues and the vascular part of it works.
Yes.
So the blood flow and
that's
keeps
exactly
the tissue alive.
So we need a microscope, and it's very, very small vessels that we use to what we call anastomose, or sew together the vessels to keep the tissue alive.
Amazing. So you got a little introduction today to Dr. McGee, cosmetic and plastic reconstructive surgeon, just joined the staff at Thibodaux Regional. Great young woman from South Louisiana, actually over there around Lafayette, which is a great place. And a privilege to have you here, and we'll talk more with her at another time.